Well, thank you, Jeff, and good morning, everyone. I don't know if I should take it personally how quickly and enthusiastically everybody fled the stage when my name was mentioned, but and I want to congratulate you for I know you've had a tremendous day yesterday and carrying on today, and there are a lot of optometrists here, but a lot of individuals representing the industry, the broader industry as well. So it's my honor to be here. Reese, my son, is not. We should make sure you get the updated CV. He's now 9, going to be 10 next year, so he's a little older than 7. And I want to apologize for everybody getting the extended resume of my past, of the good work that I did before I was a politician. And it's always challenging to look back, especially my wife Samantha Nutt is still very much a humanitarian, and to look back, it was only 6 years ago that I was sort of described as a humanitarian and a physician, and at the top of the list in terms of polling of Canadians, in terms of the individuals that they respect the most, of course. And now here I am. I've joined the lawyers at the bottom of the list as a slightly less respected politician. And I don't know where optometrists are in that. You're probably pretty close to the top, I would think, right? Yeah. You should do that. You should make sure you're included in the poll if you aren't, because I suspect it'd be very interesting to know. But good morning, everyone. It truly is an honor to speak at what is Canada's premier optometry event, and to have the opportunity to address such a respected organization that has such a proud history that extends over 100 years. And it's great to see so many optometrists, support staff, and industry leaders come together to learn from each other and to connect and to build on the standard of excellence that you've long since established. Now, I'm sure you, more than most groups, I think you lend yourself to the opportunity to have jokes built around you, right? That I could joke about focus groups, or ask if anyone in the audience actually is named Iris, or talk about our vision for healthcare. But all joking aside, eye health is critically important to the people of Ontario. I know you know that. And for that reason, it's therefore critically important to me as well as Health Minister. Our government's been working with the OAO for many, many years. And when I look at how we're working together and what we can achieve going forward, I'm both inspired and encouraged. And I've had a number of interactions since becoming Health Minister 9 months ago with members, well, with individual optometrists, but members of the OAO specifically. But ladies and gentlemen, you are at the front lines of vision health. And all of your skills that you provide are needed. Those skills in prevention, diagnosis, treatment, health information. And since the growing burden of sight loss is substantial, both physically, socially, and economically, your role is not only critically important, but becoming even more important as each year passes. So I can't emphasize enough the importance of your work. We know that some 2.2 million Ontarians have at least one major eye disease. That might be diabetic retinopathy, age-related macular degeneration, glaucoma, or cataract. And in the next 25 years, it's estimated that the number of Canadians with vision loss is projected to double. And furthermore, it's estimated that vision loss associated with these and other causes currently causes over $7 billion in direct and indirect costs just here in Ontario. But more importantly, I believe, vision loss takes its toll in very human terms. In the faces of cherished family members that we can no longer see clearly, the memory of sunrises no longer witnessed, or the decline in independence that many will experience. Yet much of this can be prevented, or at least delayed, through screening and early diagnosis, the critical services that your members provide to Ontarians every day. So on behalf of the Government of Ontario, thank you for the important, high-quality care that you provide to your patients. Now, I'm not only the health minister, but I'm also a patient. Yes, you'll be happy to know that I have an optometrist that I see regularly. And she was the one, in fact, that first identified the first of 3 retinal hemorrhages that I've had in the last 12 months. So vision at a personal level is something that I've struggled with my entire life, and as you can appreciate, with something as potentially serious as a retinal hemorrhage, am coming to terms with its importance to me on a daily basis. So you certainly helped me, as you do countless Ontarians. Not that I needed a retinal hemorrhage to know this, but my experience certainly adds a personal connection to your practice, as well as a heartfelt appreciation for the service that you provide. But while you continue to do exceptional work and consistently provide outstanding care year after year, I know also that optometry is not without its challenges. From getting patients to get their regular eye exams, to the growing concern of eye strain from today's technology gadgets, there are legitimate concerns on the horizon. And in order to meet these challenges, we must take stock of what resources we have and consider what will be needed in the future. And of course, we need to consider how we are using those resources. Can we do a better job with what we have? And what more do we need to bring to bear to make improvement for the future? I applaud the Ontario Association of Optometrists for the leadership that you have taken to do just that. Over the past year, you have undertaken a major project in developing a white paper that considers options for improving Ontario eye care. It's the most comprehensive examination of eye care delivery ever completed in the field of optometry. And what's so crucial is that you undertook this work first and foremost from the perspective of improving the lives of your patients. You also considered the challenges and constraints of government and looked for solutions within that framework. So I know that a number of you played a role in the development of this white paper, but I do want to take a moment to acknowledge and thank both your president, Dr. Jeff Goodhue, and your immediate past president, Dr. Farouk Khan, for your leadership in moving this project along. In my view, a thoughtful, evidence-based approach, such as what we have seen from the OAO, is critical for achieving positive change. And I'm told that this white paper will make recommendations for improving the state of primary eye care in Ontario while recognizing the very important role that optometry can play. And as a document designed to put patients first, I'm very interested in reading the specific recommendations it contains. I will consider your recommendations very carefully and will work closely with your association and other leaders in eye health on an action plan to move forward with improvements to patient care. Ladies and gentlemen, our government considers our doctors of optometry as a key foundation for delivery of eye health care in this province. Not only do you have the training and knowledge to effectively deliver a wide variety of urgent and preventive eye health services, you also happen to be available and accessible in communities right across the province, which represents incredible opportunities for Ontarians. Now, one of my biggest priorities as health minister is improving access to care. One way to do that is by expanding the scope of practice of our skilled and talented healthcare professionals. And by expanding the scope of practice for optometrists, you now have the ability to diagnose and treat an increasing number of conditions. Patients that previously needed to be referred to a hospital can now be treated in your offices. And to complement this, my ministry is completing its work with the College of Optometrists of Ontario on amendments to the list of drugs that optometrists can prescribe. As your skills and abilities and technologies advance, so too should your access to medications. The ministry is moving forward with the amendments, and we anticipate a decision in the very near future. And there's another initiative well, it's the right thing to do, and I would hazard a guess that it's only the beginning. There's another initiative that I'd like to applaud optometrists for today. For the last few years, the OAO has taken aim at the very serious issue that, as a father, is very close to my heart, and that's the issue of children's eye health, and for good reason. Despite your efforts and ours, each year thousands of children start school without having had an eye exam. And yet 1 in 6 children has a vision problem significant enough to impair his or her ability to learn. And that's alarming, considering that more than 80% of learning is done through the eyes. Not quite sure how they arrived at that 80% figure, but it sounds pretty impactful. But working with my ministry, the OAO has taken action with the I See, I Learn program, and it's making significant impact on kids across Ontario. I See, I Learn has been providing comprehensive eye exams by local optometrists to junior kindergarten students for almost 5 years now. Children will even get, as you know, a free pair of prescription eyeglasses if needed. This incredible service has already reached 3,400 schools across Ontario, and the program is expanding province-wide now for all publicly funded schools by 2016. As you know, it benefits us all to give these children the best chance to learn and develop. So thank you again for the work that you do and for helping our government meet our goals that were set out recently in the action plan that I released in February called Patients First. You are very much players in this game. I can't thank you enough for your involvement and your support. I look forward to continuing our relationship, whether that's building on established programs and initiatives such as the I See, I Learn or other programs, ADP, or exploring new ways to collaborate and help Ontarians see better. So I wish you an interesting and fruitful conference, and thank you again, ladies and gentlemen, for having me here this morning. And I promise to get back and have my eyes checked again soon. Thank you very much.